I'm Kevin Price with The Price of Business on Business Talk 1110 AM KTK in Houston, Texas, and with USDailyReview.com. I'm here at the huge event in Chicago, the national event of SHRM, the Human Resource Society, and thanks largely to my good friends from bestworkdata.com. That's bestworkdata.com, and they find the answers to your employee solutions, and loved working with them here in Chicago. Got an opportunity. I stumbled on a gentleman here, J. Marshall Dye. We're going to call him Jay here during this interview. He's with Defined Contribution Advantage. I love hearing his story, love hearing the work he's doing to really help entrepreneurs and business owners navigate through one of the toughest economies and really one of the toughest regulatory environments in the history of our country. Jay, welcome to the program. Kind of give us your elevator speech.
Well, the elevator speech is that I've condensed my healthcare presentation down to a pretty short sentence, and that is that the house is on fire, run away. So healthcare reform has become this gargantuan, complex, bureaucratic scenario that everyone is trying to deal with, and it's increasingly apparent that the pain threshold is increasing and increasing for both insurers and employers. And that's pretty much the way the table is set. In 2010, the Affordable Care Act implemented regulations on insurance carriers that took the actuarial and underwriting fundamentals and tossed them out the window, basically. No pre-existing condition limitations, mandating loss ratios, no limit to claims exposure.
The extending of the age of what a minor is to just below middle age. That's incredible what they've done and what they've changed. And you mentioned the fact that insurance companies and employers have been hard hit, but so have employees. A lot of people that were full-time employees have been finding themselves become, not even 30 hours, some 25 hours, because they're afraid that the laws are going to continue to adjust in order to force businesses to insure those employees.
No, that's correct. In fact, there was a recent article yesterday or day before yesterday that Walmart was making a transition to increasing the number of their employees to temporary staff. One of our companies is called Essential Staff Care, and we're the largest writers of health insurance in the staffing and temporary employment industry. And the staffing and temporary employment industry is experiencing a huge expansion of business, but they have a different thing that they have to deal with. They are dealing with the $2,000 penalty, which is a tax, not a penalty. So trying to go from a situation where previously they had the ability to offer limited benefits to these employees, 10 to 20% of their employees now qualify as full-time based on new government regulations. So they either have to provide major medical insurance to these temps or to the full-time temps, or pay the tax. So it puts a tremendous burden on the staffing industry and on these part-time employees as well. So it's a fairly complicated situation on either side of the coin for the part-time employees or for the full-time employees that have major medical. So the companies that are providing major medical, they understand that their rates are going to be increasing dramatically because of the regulations that have been placed on the insurance companies. The thing to keep in mind is that the cost of health care is the doctor's bill, the pharmacy, and the hospital bill. Insurance is a financial vehicle that chases the cost of health care. It's not intended to pay all of your cost of health.
It's meant to be exactly what it was always called in the old days, which is risk management. And the way it's best designed is if it's a shared risk between the user and the company. And the less risk there is for the user, the more abuse there is in the system, which led to things like consumer-driven health, which is a great idea that unfortunately I think came a little too late, to that debate. But that, unless a lot of it's shouldered by the user, you're not going to have sound economic thinking going into that.
I agree with that. That's correct. So where we're headed right now is that the table is set to where the regulations that have been placed on the insurance companies will result in higher insurance rates because of the change up in the requirements and regulations on insurance carriers. So the actuarial science that established stable, credible coverage in the past has been thrown out the window. So rates are going to escalate. Rates have doubled in the past 9 years of major medical without the Affordable Care Act. Now the Affordable Care Act takes all the actuarial science and throws it out the window. So rates are going to accelerate at an incredible rate at this point. So employers are going to have to make a decision. They're going to have to be faced with, at what point do I eject out of the system? Because the government wants you to pay a tax, eject out of the system, and send your employees to the exchanges. When you do that, though, you sever an employer-employee bond, which is inherent, in my opinion, that employers have a responsibility to take care of their employees to some degree. So our new program, Defined Contribution Advantage, enables an employer to pay the tax, eject out of the complex 20,000 pages of regulations that are clarifications of clarifications of clarifications of the health care bill, and eliminate the Internal Revenue Service auditing your health plans. You're paying your tax, but then you purchase a layer of basic health care on your employees that enables them to go to the doctor's office and receive basic health care without a deductible or a copay. The employee makes no contribution. The employer pays all of it. And then the employee is still eligible to obtain federal subsidies, go to the exchanges if they wish, and buy their catastrophic coverage there. So the employer is still able to use benefits as a retention and recruiting tool and have his relationship with his employees.
Kind of have his cake and eat it too, in other words. And what's awesome about this is that when you hear about this thing, you think of mega Fortune 50 companies are the only ones who are navigating around here. Your sweet spot are 100 plus employees.
Well, there are 157,000, according to the Department of Labor, 157,000 companies in America that have between 100 and 500 employees. They represent about 29 million workers. A lot of the surveying and analysis of the situation has taken place in the Fortune 100 companies. But these companies have to apply by the same regulations. These are the companies that don't have necessarily the deep pockets that the Fortune 100 companies have. So they are the ones that need to be able to eject out of the system, pay the tax, purchase a layer of benefits on top of that, and maintain that recruiting and retention bond, because they need that competitive edge out there where they're not spending a huge percentage of their revenue on health care. So we think that is a tremendous market, but our product is available to any size. We have clients with 90,000 employees, 300,000 employees, but the unserved market, the ones that really need the attention, are going to be the 100 to 500.
Got to wrap it up real quickly. What's your website to get more information?
It is Defined Contribution. It's right here. Okay, I'm sorry. It's dcasolution.com.
There you go. dcasolution.com. And Jay Dye has been my guest. Thanks so much for being with me.
All right, thank you.
Enjoyed it. All right. We want to give our thanks again to bestworkdata.com for providing this opportunity. Again, Kevin Price reporting from Chicago from SHRM.